Now, ain't this a fucking familiar ass sight? You have Michigan undercounts their COVID nursing home deaths by 30% in an audit. They found that out. Where have we heard that before? Okay, because we've known that a bunch of these different blue states had the exact same policies that, oh my god, Andrew Cuomo, the former governor of New York, had in place for his own state. You had Michigan. You had Pennsylvania, you had New Jersey, you had Wisconsin even. It was all over the Northeast and even seeping into the Midwest, however you want to categorize. And Wisconsin and Michigan, you guys practically share a border. Well, in actuality, you kind of do up there with the peninsula. But is this audit coming out and all of these numbers getting released because, oh, I don't know, maybe the Kamala Harris side of the White House realizes that Gretchen Whitmer might be more of a liability than an asset, really coming up close to her re-election campaign at the end of this year? I don't know, maybe. It's an idea that's out there. But Michigan, like I said, undercounted COVID-19 deaths by 30% in nursing homes. The administration of Michigan Governor Gretchen Whitmer underreported the number of nursing home residents who died from COVID by 30%. 30 fucking percent. And this isn't coming from some fringe report. This isn't from Ted standing outside of the nursing homes just counting with a clipboard of the fucking body bags that come out of the nursing homes. This is from the state's Auditor General. So if you want to appeal to authority on this one, this dude's got the receipts. Auditor General Doug Ringler has been haggling with the Michigan Department of Health and Human Services for months over the numbers and how to count them. His final report was made public on January 17th, earlier this week. At the start of the pandemic, Whitmer, a Democrat, issued an emergency executive order to place infected senior citizens in extended care facilities that had the ability to isolate them in a designated wing. As the infection spread, many residents and healthcare workers died. The audit found that 8,061 elderly Michiganders died of the disease in the state's nursing homes between March 2020, and July 2nd, 2021. So a little bit more than a year, okay? They officially posted death toll was not 8,000, but instead 5,675, as self-reported by the state's extended care facilities, which is required by law. So where are the other 2,300 deaths? Okay, where are they? Where'd they go? Are they missing? On the face of it, that appears to be the undercount by 42%. The audit provides 13 pages to explain why the real undercount was only 30%. Oh, were there misclassified COVID deaths? Wow, that would be a novel concept. The auditor finding prompted Republican State Representative Stephen Johnson, chairman of the House Oversight Committee, to call for hearings. Oh, you love to see it. The state's Department of Health acknowledged in a letter that the previous total of COVID long-term care facility deaths is 30% lower than what the Auditor General found. Johnson, who asked for the audit, said in a January 13th statement, "This is a large discrepancy, I'd say. There is frankly a lot to answer for, and our legislative panel will be working to get those answers." By the way, okay, spoiler, Whitmer's not going to participate in any of this stuff. Asking her to be accountable? Oh my god, you'd have more fucking compliance from a group of high school cheerleaders. You'd probably have less sass and talk back from them. A week before the auditor's findings were made public, the Whitmer administration was already putting out their side of the story. Listen, it's really hard to count, and a bunch of us were drinking Flint water, so, you gotta forgive us a bit. January 9th, 2021, okay, so a year ago, letter to Ringler, Elizabeth Hurdle, director of the state's Department of Health and Human Services, said a Whitmer appointee was running cover for her boss. Oh my god, could you imagine just the scandal? Explained that the additional deaths found in the investigations were due to a difference in counting procedures and not an intentional undercount. Oh, it's just human error. Okay, we weren't trying to hide anything for years on end. Hurdle wrote that the audit's numbers combined COVID deaths in facilities that were required to report to the state and those that were not required to report. Oh, okay, cool. Not saying that they didn't die of coof that they caught in the nursing homes, but instead, different reasons. Could you explain those different reasons? No, we can't. Oh, okay, cool. Creating the impression of a larger undercount by long-term care facilities that were warranted. Okay, cool. So if we want to go on the narrative that all of these lockdowns were predicated on falsified numbers, okay, you were just looking at the deaths of people, and a lot of the deaths occurred in these long-term care facilities, and you were underreporting them. I think you probably should hold some hearings, because there's a lot of uncomfortable truths that need to be reconciled here. Hurdle wrote also said that she has serious concerns that the audit's methodology. Oh, okay, yeah, question the audit, not the findings. Just, oh no, that was clerical error, and the audit's corrupt, and it's run by cyber ninjas, and we're gonna sue you. Could lead to the official state count being misinterpreted. I thought we're just supposed to trust the science in the numbers. Aren't they all accurate? Oh, wait, they aren't? Oh, fuck. And could call into question the work and integrity of long-term care facilities. Again, nobody's questioning their ability to do their jobs. They're just saying that it was a little bit too difficult, but it became easier over time as a lot of their patients just started to die off, so they had fewer people to look after. Local health departments, coroners, and other frontline workers who rely on the report data. I'm sure they probably also rely on that data to be accurate. I'm just throwing that out there. The audit's table data is missing or is misleading and appears to suggest that there was a 30% underreporting when in fact it was 42. Anyways, where almost half of the differences can be attributed to the facilities not subject to reporting requirements. Again, not saying that these people didn't die because of the policies that were put into place. They just didn't have to, contribute to that. Okay. They're still counted and they're still on the list. They just didn't have to get lumped in there. Okay. So trust us. We're doing a good job. An additional 1,036 deaths were identified when your team looked across all long-term care facilities rather than limiting the scope to facilities subject to state and or federal reporting requirements. I'm sure that'll be a very compelling argument once those hearings start to happen. Hurdle also cited problems with different definitions. Oh, okay, cool. We have our truth and then there's the truth, but our truth is what we report. She said long-term care facilities were only required to report COVID deaths within the definition provided by CDC. Which definition is that, and which revision of that definition are we going with? Hurdle also criticized the auditor's resilience on data from the Michigan Disease Surveillance System. Again, relying on actual, factual, official data, that's a problem. What are you trying to tell us here, Hurdle? Which she said was not appropriate source for determining if a COVID death or a COVID case resulting in death should be counted as a death in a long-term care facility. Oh, semantics aplenty. But trust me, if somebody just dies with a positive test, you'll count that as a COVID death to keep this pandemic going as long as possible. But when it's not advantageous to do that for you? Oh, no, we need to start to separate all this stuff, okay? No. That person didn't die in a long-term care facility. They were taken off the grounds, kind of like what happens in fucking Disneyland. Nobody dies at Disneyland. They just die in the parking lot. It's fucking weird. That's the most dangerous parking lot on earth. But no. They got drug off the premises. Or no, they didn't die. They just had a massive cardiac attack and they just tested positive. It's not like anywhere else in the world, if a fucking blunt force trauma occurs and somebody, it pops for the coof, it's not like they get added, or they have a knee on their neck for 9 minutes and like, oh, I don't know, let's pick a place, Minneapolis, and then that gets added because they tested positive in the fucking coroner's office. Not like that's ever happened before. Anyways, she called using the system an outdated and clunky platform that we've continued to utilize. What? Big cell phone there. Okay, so was it outdated now or at the time? Okay, it was a clunky platform that we've continued to utilize. So it was fine unless you're looking at the numbers and try to double check the work. Huh, interesting. Okay, because we have been able to upgrade or replace it. So maybe let's just say if they're running the numbers back and they were looking at all of the official data that's out there and they still come up with the same conclusion that you underreported by about 40%. Is this still outdated and clunky because it doesn't quite fit the narrative that your boss was really looking out for the people of Michigan? God, it really sucks to be a Democrat there. State health officials in New York were also under fire for allegedly undercounting the number of COVID deaths among the state's nursing home population. But yeah, though, that probe after Cuomo just decided to step down, gone. Just like Kaiser Soze, just walks away. Oh, just take him down for sexual harassment. Let's see if these hearings do go ahead, because there is a Republican majority in both the House and in the Senate in Michigan. So there's going to be some hearings in some form or fashion. So let's see what other scandal, or maybe, I don't know, somebody will just imagine this, pretend to capture Whitmer. Oh my God. And we just need to go ahead and get rid of this evil partisan hack attack by the Republicans who just want to, I don't know, figure out why their grandmother's dead. You can already see it. They're probably trying to scheme something up. Maybe they're on the phone just trying to see if there's any other feds available to concoct something. Or if this just gets dragged off a little bit farther into the spring, maybe some horrific boating accident will happen to her yacht-faring husband. Don't know. Can't quite figure any of this stuff out now, can we? But yeah, after investigation and a sample of 62 of the state's nursing homes in late spring of 2020, New York Attorney General Letitia James, a Democrat, concluded COVID deaths associated with nursing homes in New York State appear to be undercounted by the Department of Health by approximately 50%. Yeah, but it was just a clerical error. Don't worry about any of that stuff. Your Nana died, and there was nothing we could do about it. It wasn't the policies at all that killed her. Don't look any further into it. But speaking of things that you shouldn't look any further into, more details over a year later when it comes to Ashley Babbitt, and these kind of make my blood boil. Not as much as this, because this whole fucking nursing home tragedy is something that's just going to get swept under the rug once this pandemic is finally fucking over. But it's something that people should be made aware of, and I'm going to do my part up next. With that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.